Physicians Advisory Group member Dr. Felix Cabrera went over the latest numbers, which show record hospitalizations and the positivity rate that is currently at 14%, the highest in quite a while.
If you are sick, do not go to work. Quarantine at home and get tested for COVID-19.
Cabrera says the same goes if someone in your household is sick. If you have COVID-19, he says, isolate safely from your family, and if you're infected and can't isolate safely at home, go to a government quarantine facility. Meanwhile, Dr. Annette David was asked to help analyze some of the accumulated data since the infection started. It shows, among other things, that the highest infection rate was amongst Chuukese, and the highest death rates were amongst Filipinos. But to be clear, she says, it's not because of their ethnicity.
There are social and environmental determinants that put some of our groups at higher risk than others.
And that could be living in small, multi-generational households, medical costs, loss of health insurance, and lack of information. But the data is also allowing public health to hone in to COVID hotspots and be proactive instead of reactive. That's according to Public Health Director Art San Agustin.
We're going out there where we're seeing the numbers, the concern, the social challenges that any community or subgroup may have in our community is what we're looking at too.
Specifically, what they're looking at now are neighborhoods in northern Guam where about 50% of all cases are found. Despite this new hotspot targeting and the fact that positivity rates remain high even after weeks of the current PCOR 1 lockdown, the governor is still not convinced that she should lift more restrictions.
Mobility is also a factor, I think, in the spread. And if we can decrease mobility, then we are decreasing the risk of exposure and transmission. And so I think the much better focused and the much better intervention is to go in there and identify those that are susceptible, test them, and provide isolation and then also education.
But at the end of the day, the governor adds, the way we stop the spread will ultimately rest on one thing: individual responsibility.